All right. If we could all please gather up. We're around for round 2 of the morning session here. Remember, if you're going to take pictures of us, or if you're going to take any sort of things and post it, hashtag Cure Workshop, hashtag HIV Cure. All right, this is the best part of the evening, or the morning, whichever day it is.
So please join me in congratulating Richard Jeffries and Michael Louella in a wonderful community cure workshop. Hands down, the best meeting on cure research in the entire year, where community and researchers come together and talk about cure research in community-friendly terms. And now we turn to ethical considerations for cell and gene therapies. There's been a lot of press on this in the last few months in light of the Chinese gene-edited babies. So we'll talk about ethics of HIV cure-related research. And we thought we would revisit the case. We have to say, I'm not an expert on cell and gene therapy. I will rely on Michael, Lori, and Tom Hendricks from the defeatHIV team to help us here. And I also have to say I'm the accidental practical ethicist. So I wish to make ethics very practical and applied. So what happened with the Chinese gene-edited babies?
Good question. We'll try to give you a quick summary. So the man in question, the scientist, is named He Jiankyu, and he was an assistant professor at South University of Science and Technology in China. He also happened to be an owner of 2 biotech firms in the area around there. I like to mention that just so people have that information. And he basically used the CRISPR-Cas9 gene editing system to make embryos HIV resistant by knocking out the CCR5 co-receptor, the gene that creates that. And he did this gene editing on the embryos and then implanted them into the mother, carried them to term, and gave birth to twins that were experiencing this. So he made an announcement then in public, but he didn't do it the normal way. Can you go back? Yeah. He didn't do it the normal way that you would expect that. He did this right before the second International Summit on the Human Genome Editing. It was in Hong Kong. It was in November, and that's probably how most of you heard about it, because instead of doing the sort of thing of like where you have data and that you seek to get it peer-reviewed and published in a paper, he went right to YouTube and a PR firm and basically announced to the world this, which then made his talk the following day one of the most highly viewed streaming videos ever. So it really did work in terms of the tease and getting all the attention that he obviously sought. So in this case, the male of the partner, the husband, was the one who was HIV positive. The woman who carried the babies to term was HIV negative. And you may already think, if you know anything about the vertical transmission of HIV, the risk for those 2 twins being born with HIV was quite high or low? Which one? Right, so his sort of justifications there, if we're going to get into the ethics of it, the reasoning behind this is also in question. So we have 2 baby girls now who are twins, who are now mutated. And it's not really the mutation that you would expect, because actually he did not succeed in either case of creating the CCR5 delta 32 deletion that infers the HIV resistance to the people who get that. So we have 2 new mutated human beings who we don't know what's going to be the consequences of them, but neither of them were successfully gene edited. So why is this so controversial? You can kind of see here. We have 2 different ways and 2 different reasons. So you have the somatic approach, which is basically not being able to be produced and go down through and pass on to your offspring, or you have the germline. And the germline is the type of editing that would be then transferred to your children and your children's children and affecting the human race from there on. And so you could also get this for therapeutic reasons, and just so you'll see when somatic and therapy meet together, that's where most of medicine and research is focused. What he did was actually the germline. He affected those children as well as those children's potentially. That mutation that we do not know in both of them, which is different, is now going to be passed on if they choose to have children. And that's one of the things that I find troubling with this, is that we're talking about edits that were made without any sort of preclinical work, without any sort of animal work. In terms of that preclinic, he went right from his idea into the embryos. which is another very shocking thing. But you could also do enhancements, just to say there. So you have the somatic enhancements, which you would think like with plastic surgery, but then you could also do the designer baby thing, where you're changing the entire DNA of someone to give them stronger muscles or brighter minds or sharp white teeth. Next slide there. This reaction to what the news was, lots of people sort of came out with reactions, and I remember the NIH itself came out with a very strong statement against this, but the community also had some reactions there. And so we have here an example of the tag comment where they joined with the ethicists and the scientists who were condemning the work as unethical, unjustified, and potentially dangerous. God, is that you? Yeah, this is me as well. So the risks outweigh the benefits. There's so many things that we could go on to here, but there are safe and effective and easier options to prevent mother-to-child transmission besides doing this specific technique. So the reasoning behind why he was pursuing this, there were other ways that could have been much, much safer. And again, he was altering the germline of these young women. They are now forever edited, and one of the things that I find troubling with this is sort of like the experiments with Dr. Mengele. We're not going to do anything else, we're going to go right into human beings with it, and now these girls' lives, for the rest of their lives, are the experiment. We need to follow them and find out what's going on. One of the things that he promised, which is another contentious source, is when we get to the consent form, he promised lifelong medical care for them. And that's sort of an egregious promise to make to them, but there's lots of things that he promised. The incomplete ability of the CCR5 gene deletion to prevent HIV acquisition. You may not know, but there's another trope to the virus, which is called the CXCR4, which even though if you have the CCR5 deletion, you can still be susceptible to about 5% of the different strains of HIV. So it's not fully protective as we would hope. And the safety of experimenting with CRISPR-Cas9 in human embryos is not well established at all, which is why he should have had some preclinical work done to show reasons. We can see when you talk about this in further detail, you can see that he asked a lot of people for advice, and then he never followed anything that they said. So that's one of the egregious parts of this story. The informed consent was very questionable. The two participants involved in this were under the belief that they were in a vaccine study. So you can just imagine what the informed consent process is if they have a different idea entirely of what they were involved with. This was not gene therapy to them, it was a vaccine study. So was there exploitation or coercion? You could ask that question when we go into the informed consent specifics. And was there any sort of robust review from sort of regulatory agents or ethics review? He did ask one-on-one lots of different ethicists what they thought, and they told him what they thought, and he still kind of ignored that and went ahead and did it. And the other thing that's really questionable is the secretive part of this. He was very secretive about doing this experiment, but then he comes very public when he's about to present his data, and it was not carefully peer-reviewed. And so that really sort of undermines all of his credibility in this issue. Is this me as well?
Yes, that's you.
Oh, all right. Well, we don't have the heading here, but these are even more of the ethical problems here. So there was there's a failure to determine the appropriate study participants, who he was actually trying to select. And at least one of the twins was a mosaic, and in fact, I read up more on this. Both of them can be considered mosaic results of gene editing. So neither of them got the CCR5 delta 32 that was going for. They both have some altered view of that, where some of the genes that make up, or some of the, what do you call those, the alleles, some of them were left, some of them were hit, some of them were missed. So when you get that from both sides of the mother and father, that's where you get the high resistance from it, and he did not achieve anything that looked like that CCR5 delta 32 in either of the cases. So the editing took place after the embryos started their cell divisions, and the patchwork of edited and unedited cells is very complex, but each young girl is different. So both of them had this editing technique, but each of them turned out differently. Both of them are mosaic cases, and we're going to have to figure out what that means for them, because no one before has existed with this type of mutation, because this mutation was man-made, human-made. What happened to the other embryos generated through this intravenous fertilization process? He claims that there's another woman who is pregnant with another edited embryo, and this is sort of a slippery slope. Most of the community work that I've done really, they hear the therapeutics that we're talking about, but they jump ahead of us and they just start thinking about designer babies and enhancements that are more cosmetic than needed for medical purposes or for a healthy life. And there's even fears about eugenics, especially in the US where we did have eugenics programs. People can see gene therapy and cell therapy as a way to basically get rid of populations that are undesirable, which sort of echoes the origins of the modern HIV epidemic that we hear. There was the 4 people that it was against. They believed that the virus was man-made to take care of minorities or gay people or hemophiliacs, and it's sort of the H's there. The deletion of the CCR5 gene could increase risks for other viruses. So even though they didn't get exactly what he was going for, if you are missing that CCR5, you are, for instance, more susceptible to Hep C or to the West Nile virus. So even though he was creating this supposedly to protect them from HIV, he was still creating situations where they would be susceptible to other diseases as a result of it. However, again, since he has not achieved that, we don't even know what it could be. It could be that they're still able to be infected with HIV and susceptible to these things. So he could have created a much worse situation. And the real big question is this one example, will it put this whole field of cell and gene therapy in danger? Because people are going to know this and think about this case before anything else when we try to get them to, for instance, go into a study for the protection against HIV.
Thank you, Michael. So Michael described the case and mentioned some of the informed consent issues. We actually have a copy of the informed consent form.
We've got to pass it around.
So the informed consent process is a critical process in research. This is when we tell participants about the purpose, methods, risks, and benefits, and alternatives to research participation. And as Michael said, this was advertised as an AIDS vaccine development project. So you can imagine just the ethical issues and the red lights from the beginning. And then as you read the consent, you can see potentially problematic statements, and I'm going to read just some of them to you guys, and please feel free to react. So the gene editing in the embryo would knock out the CCR5 gene. It would help the CCR5 edited baby to obtain the genotype of the Northern European to naturally immunize against HIV. So this was advertised as a natural immunization project. Then it says this would decrease the risk of off-target issues and other risks, when we know that gene editing may be accompanied with potential off-target edits. This technique may be able to produce IVF may be naturally immunized against AIDS. There's a possibility that some embryos do not have anti-AIDS ability. And then the project team is not responsible for the risk of off-target, which is beyond the risk consequences of the existing medical science and technology. Okay. Then, neonatal malformations, congenital deficiency, suffering from common genetic diseases belong to the scope of natural risk of natural reproduction, and the project team does not assume legal responsibility. You see a problem with that? Then, potential benefit of the study. This research project will likely help you produce HIV-resistant infants. But the rest of the consent form, though, tells you that you may not be able to have an AIDS-resistant baby. And then if you decide to leave the study due to other reasons, you will need to pay back all the costs that the project team has paid for you. If the payment is not received within 10 calendar days from the issuance of the notification of violation by the project team, another $100,000 of local currency, 100,000 RMB of fine will be charged. So think about the coercive aspect of that study. And then finally, the baby's photo and the date of birth will be kept by the project team. The project team has the portrait right of the infant and can make it open to the public. So these are just some red lights. And when we talk about ethics, a lot of the considerations apply to the field in general. And as Michael said, in this case, a line was crossed. So in any ethical considerations or any ethical review, we would weigh the risks and benefits of the research. That is a key hallmark of these ethical decisions. We must ensure that the research has a higher chance of doing good overall than doing harm. That is the principle of beneficence in the Belmont report. Researchers should also do everything they can to minimize risks and maximize benefits. We need to protect participants from excessive risks. And we know that it can be difficult to evaluate these because there can be asymmetries, meaning that the risk will usually accrue to the participants while the benefits will accrue to science. But in this case, it was a clear-cut example of research that should not have gone forward, and we know that he got dollars from the Chinese government to do these studies. Other things to consider to evaluate risks of HIV cure research, and a lot of you work on community advisory boards, so you review these studies. These apply to all kinds of research done with human participants. So we must look at the innovativeness of the intervention, the mode of action. Is this a gene therapy? Is this a pharmacologic approach, for example, a stem cell transplant? We need to look at the nature of the target, the relevance of animal models and preclinical evidence. And for certain groups, we may need stronger evidentiary justification or stronger safety and efficacy signals before we move into human studies. So this is particularly the case with fetuses and embryos and even pediatric populations. We need really good safety data before we move on to humans. And then uncertainty, which is a major hallmark of first-in-human studies, and it is different from risk. So these are what we would look for. So gene modification, most gene modification being done, actually all of it except for his experiments, is the somatic kind, the kind that Michael talked about. So it will not be passed down from generation to generation, and that is the line that is crossed. So it could take several forms. You could have large DNA fragments that are inserted. You can also have subtle modification of single or few nucleotides of DNA elements, or you can also have deletions or inactivation of entire genes. But all the research done to date had not crossed that germline. And Michael will talk about different types of cell and gene therapy that is being done right here in Seattle.
So just to give you a little bit more information, that previous cartoon that you just saw was just trying to show how the editing of a cell happens. I don't know if we need to go back and see that because it's kind of primitive to look. But you should know that there are these different molecules that we use as molecular scissors that can be used to cut strands of DNA. The first that's been used, especially in terms of HIV trials, are the zinc fingers. Sangamo Biosciences was the one who did some the first HIV-related gene editing and cell therapy, and they used the zinc fingers to basically take people's T cells out and make them resistant to HIV, and then multiply them in the lab, and then give them back to the people. So you're getting your own cells modified and then give it back to them. And they've shown that while this did not lead to a cure, it did have clinical benefit to many people, especially people who had a poor immunologic response. In other words, when they started antiretroviral therapy, they may have gotten down to undetectable, but they never got their CD4 counts to rise. That normally happens. So when we have people in that situation, it seems like getting this cell and gene therapy approach with the zinc fingers actually gave them that first boost that they've ever had while being on antiretroviral therapy. And there's now a study, I think it's Case Western, and Rafiq Sekaleh is going to be doing that, where with a lot of community input, we finally convinced the NIH to fund a study that was looking at the clinical applications, not related to cure, but to actual just clinical approaches for this in the clinic. We also have the tau effector nuclease, and the one that you've probably heard most about is the CRISPR-Cas9 system, which has its own variations on it, but the way they use the Cas9 to sort of hone in and be able to clip out. There's been some research done with this in animals that looked like it could actually excise HIV from cells and thereby reduce the reservoir, but that is not yet done in humans. And megatals is the last one that we have there. So these are all the molecular scissors, if you ever hear people talking about them. So assessing the risks and perceptions of gene therapy, there's an international survey that was investigating gene therapy researchers' perceptions and the assessments of risk in clinical trials. And there's 156 as the population there, and the strength of their preclinical evidence strongly influenced the disease, the risk of disease severely, assessments and judgments of acceptable risk levels, the perceptions of uncertainty, and you can read the rest of those yourself. But there is differences between the stakeholder types in terms of their approaches to that, and we have not yet done this type of research to gene therapy related to HIV cure.
Great, thank you. So that's probably why we may need to have social scientists involved in the cure research process, is to help define acceptable risks thresholds, particularly as we talk about different population types. So this article by D'Agostino talked about 6 different categories of potential participants involved in HIV cure-related research. Like as Linda talked about, if we know that the background health of the population is very good, this will influence the level of risk that can be taken in these kinds of studies. Most HIV cure-related studies have otherwise healthy volunteers to participate. If participants have, for example, concomitant cancer or other conditions, then that might influence the risk level that can be taken. So in all HIV research, or any research, we need the least vulnerable population that can usefully answer the research question. So if he had done this assessment, risk-benefit, he would have found that this experiment was unfavorable. And we also need more regulatory perspectives as we move forward. This is an article that was recently published, looking at different regulatory hurdles that will need to be overcome with cell and gene therapy. For example, the potential for off-target activity, so we need really good assays to be able to predict and identify these off-target effects. We also need different ways to assess the durability of the intervention, etc. So this is where we need a broad stakeholder input to ensure that these studies are ethical. We also need to continue assessing public attitudes around human genome editing. This was a recent survey that was done in the United States, looking at acceptance of gene editing, and it seems like there's greater acceptance toward somatic therapy.
So you can see here the prevailing public perceptions in the matter. Basically, this was a study conducted in the US and Canada with a population of 467 people, and the receptivity of cell and gene therapy increased for conditions that appear severe or life-threatening, which probably, if you think about it, makes sense. In other words, if there's a condition that is threatening to your life, people saw that as being more acceptable as a way to be using cell and gene therapy as an approach, and that's what a lot of this data is just showing us. And as well, there's been a lot of statements about cell and gene therapy, and there seems to be a surge that's coming of this technique being used in HIV as well as outside of HIV. So the FDA says that they're witnessing this surge of cell and gene therapy products that's entering early development. They say by 2020, they'll be receiving more than 200 INDs per year. And then by 2025, they were saying that the FDA will be approving 10 to 20 CGT products a year.
Can you just say what an IND is?
What is an IND?
IND is an investigational new drug application. It is the process to move studies forward from animal research to humans. It's a key step in the research process. What is the first in human experiments? And the FDA gives investigators, usually takes 30 days to review a protocol. If it gets back to the investigators with changes, investigators have to comply. The FDA has put clinical trials on hold through the IND process. It is a critical step in safety.
And so the FDA also is planning to introduce a new policy guidance and other advances relating to cell and gene therapy, and that's supposed to come out sometime in 2019. And as they say, they are trying to encourage advances in science, but remaining concerned that a number of individuals are working outside of regulatory compliance. And especially given the nature of the CRISPR-Cas9 system, anyone can basically access it and anyone can inject themselves with it. As we've seen, if you've been following any of that news, there's at least one individual who made a little public statement about how he was going to be doing something to augment his own genome, and he injected it in front of news cameras as more, again, of a publicity stunt. But they say, the FDA says that they're going to do additional enforcement actions in 2019 to address products that pose a significant risk or potential harm to patients. I'll also say that the Chinese government just announced 2 days ago that they're going to be upping their own regulatory processes they're going to have, for cell and gene therapy, they're going to basically have an overview committee that's going to be on a national level, and that's for anything that's of serious consequence, and if it's deemed not serious, they're still going to have local health departments within China be partners in the regulatory process, trying to add additional eyes so something like the experiment that happened, that we've just learned about, won't happen again, so they say.
So we do have safeguards in place, especially here in the US. Again, with the FDA IND investigation or new drug application process is a really critical step in moving these experiments forward. There's also a committee called NIH Recombinant DNA Advisory Committee, or the RAC, that was established in 1974 to review any study with cell and gene therapy. There's also good manufacturing processes or practices to ensure safety, purity, potency, and I would also say specificity of these interventions. And then the FDA will come up with all kinds of guidance documents. There's a web page, a cellular and gene therapy guidance, and these are produced by the Center for Biologics Evaluation and Research, CYBER. The WHO also created a new committee to guide editing of human genes as a result of this experiment. This committee has 18 members that will examine the scientific, legal, ethical, and social challenges associated with human genome editing, because we know that laws vary quite a bit between countries in reviewing these studies. But we also have experiments right here in the United States on gene-edited embryos. So this is an example of a team at Columbia University that examines newly fertilized eggs injected with CRISPR editing tools. This scientist stops these modified embryos from development beyond day 1. So the goal here is to prevent inherited diseases, for example, cystic fibrosis, Huntington's disease, or retinitis pigmentosa, or blindness. So again, we need really good safeguards in place to move these experiments forward. We know cell and gene therapy will increase in frequency as we move forward. So we do have discussion points for the community. Michael, do you want to read them?
Sure. Well, the first question, why don't we go through,
Sorry.
So, what do you think is our obligation as community members? What do you think in this new technology has just been unleashed? We have all of this happening, and what do?
We don't stay silent.
We don't stay silent? Go ahead.
I mean, we really need to look at these informed consent forms, especially if you're in China.
So looking at the consent form, especially if we're in China, and I don't know where that consent form is being passed around, but hopefully it's you're given a chance to see. We pulled out some of the language for you, but you can just see all of the egregious things that we brought just to task there, with people not knowing what they're actually getting involved in for real. It just is a very damning piece of evidence. Go ahead.
The thing is, how do these things get through those kind of conferences? I mean, I'm a very casual academic.
Yes.
Almost stalled, so casual. But I get invitations to that conference. And so I just wonder, one of the kind of ethical things that we need to kind of think about is what conferencing is doing and what it's enabling. And it's enabling these kind of things to get through any decent peer-reviewed processes. Maybe that's a comment, but maybe you can say something back.
That's a very good comment, because I wondered just how much of this wasn't orchestrated using the conference system to launch PR. In other words, it seems like to me this man was doing things and he knew what he was doing, including the fact of hiring a PR firm to help him with this. So he was really worried about the publicity angle. He wasn't really worried about the peer review angle. And what role do the conference organizers have in that? Because they seem to be complicit in giving him a platform with the chance of explaining himself, but it really seemed like they benefited a lot because they had a lot of people tuned into that live streaming. So we have Richard, and then we have Moses.
Yeah, I mean, I just think that as a, one thing as a community, we really don't want debacles like this to sort of slow down what might be appropriate progress therapeutically for people, and that is maybe a concern to think about, that the sort of the reaction doesn't actually affect researchers who are doing legitimate work. And I think it's maybe worth mentioning that there is actually a study in China where they're using CRISPR-Cas9 to try and replicate the CCR5 mutation in stem cells for people with HIV that need them for cancer. And they've actually published studies. It's legitimate work. They're trying to sort of replicate what happened in Timothy, but without the need to find a donor with the mutation. And so I just think it's important that the good work isn't affected by it.
This is a really good point. There are people doing this the right way, following the right review process and regulatory standards. So we must ensure that these types of experiments do not stifle the whole field. We also need to generate more public dialogue around cell and gene therapy and also educate our stakeholders around the possible risks and benefits of the interventions. We need to engage the community advisory board in reviewing these consent forms. This is another critical safeguard in research, is having community people review the consent form of the protocol to make sure that this can move forward ethically. Moses.
Thank you so much for the presentation. My question is, do we have an international joint regulatory body? And if we don't you think it's high time as advocates through WHO maybe to start advocating for an international joint regulatory body which can handle such cases? Because I think FDA can go to China.
Good question.
Yes, that's a good question. So he was asking if there's an international regulatory body, and as we reported that the WHO had just, in the past 2 weeks, started to form one that's going to have 18 people. I don't know if there's any community on that, though. I don't,
Yeah.
it didn't seem like there was. Say what?
That's advisory, not regulatory.
Advisory, yeah.
Yes.
So, we've been hearing about unethical trials being conducted in China for as long as I can remember. Now, we have the FDA, we have that reviews, protocols that, if you don't get past the FDA, that's what the IND is for, approve or not your study. The same with the RAC for immunologic sorts of studies. They don't, apparently they don't have that kind of stuff in China. There's nothing at the top that says, are you kidding me?
Right.
So, and I'm not sure how much effect we can have on China, except to maybe, at whatever turn we can, embarrass them publicly. I'm not sure they'll listen to any board. I can imagine if you're an activist in China, you might get locked up and the key thrown away if you start screaming too loud about this stuff. But I think that they, I think they'd probably be very, very upset by bad press and the face and all that sort of thing. But I think that might be a way to do that, to at least get the government's attention that the rest of the world's not going to put up with this.
Right. And again, just to report, it just came out 2 days ago that China announced that they are starting regulatory processes for cell and gene therapy specifically. So obviously, in a reaction to this, they're going to have a national level as well as in a local province level. Go ahead, Jeff.
Did anything happen to the guy? Did I miss?
So this is interesting because I've heard so many conflicting reports. It seems like there's not a lot of ability for us outside to assess, but he was put under house arrest. But he was interviewed and he was told to be very happy, doing well. And, but who knows what that really means, what's going on. There were calls for him to get the death penalty as a result of what he's done. There's a lot of universal condemnation that seemed to come around the globe, but then the other thing that was troubling to me is that there are these one-off scientists in the West who were not really condemning it. In fact, they were sort of like, well, this was going to happen anyway, so now we've been pushed through the door, and they didn't seem to have that sort of sense of outrage at what is happening. So maybe they were trying to be clinical and not possessed of their passion, so to speak, when they were talking, but it came across as if they didn't really care what was happening. Go ahead, Josh.
Yeah, I just want to make a general point about what the role of the CABs would be in all of this. And this is the most egregious example, but every day, every PI at the Hutch wakes up to 10 emails advertising a conference that is barely real, and 10 emails advertising journals that are barely real. And, we've been trained to ignore them, but my sense is that there is a stream of real science and a stream of fake science that exists, and it's not exclusive to China by any means. I think that there is a strain of false scientific belief in this country as well. And so we as a community are deeply appreciative of your ability to communicate to the community what's real and what's not. And also what is difficult about real. It's not as if the real interventions we're proposing here are known to be safe.
Right.
And so it's but I just want to express our appreciation for that, because we often don't have the time, or wisdom, or the communication skills to do this perfectly. So thank you.
Thank you. And this science is really complex, so we have to be able to communicate in lay terms, and we can say what we want, but the FDA IND process and the RAP exist for a reason, and they have a really important role to play. There's also a lot of variability in how the institutional review boards review these protocols as well. So that's another thing to keep in mind. I think Richard had his hands up.
Timothy.
And Timothy.
I was just thinking about my case and how ethical that was. Everybody's aware that my hearing took place in Germany, in Berlin, and I don't want to really criticize the research, but I'm thinking it wasn't peer reviewed. It basically went through the review process of that hospital, but I don't think it went beyond that. In fact, the transplant professor did not even know that that this was taking place. And I mean, I was very lucky to have survived that and doing well.
Did everyone hear? That's interesting. He was bringing up his own case, Timothy's case, and wondering about the regulatory processes around what was done in that experiment that led to his being cured. Didn't think about that, Timothy.
Something that doesn't get discussed so much is that actually nobody knows for sure whether if you get a stem cell transplant from a donor that has the CCR5 mutation, whether your chance of success with that stem cell transplant for the cancer is as good as somebody that gets a stem cell transplant from somebody without mutation. It hasn't happened to enough people to be sure, and I think thankfully there's a couple of cases it seems being presented at Korea where things have gone well and it's worked for the cancer, but I think it's just very difficult to make those kinds of assessments.
Right, and so we'll be able to ask those questions probably this afternoon when we have someone from ISOSTEM, which is the European consortium that's working on stem cell transplants with the CCR5 delta 32 deletion. We'll be able to find out a little bit more and ask those questions specifically. Go ahead.
Just the one other thing, I sort of know what you're saying, Linda, but I did want to push back a little bit on sort of blame China instead of Canada kind of thing. Just because I think, there was a really instantaneous reaction from Chinese scientists to what happened. And although there's certainly differences and some bad history there, I don't think it's across the board.
Right. And there was, that's very true. The Chinese scientists seem to immediately condemn what he has done. I saw a hand up over here. Go ahead.
I think it's also important for us to keep in mind that there's a difference in what a individual decides with their provider in terms of what happens with their care and trying to manage their lives, and what's done as research and development where someone is actually given a formula, as we have seen in this situation, that doesn't seem to provide the person with an actual opportunity to be informed about what the experiment is, or the experiment is something different than what it says on the form. And so that, research versus care from your provider and the decisions you make. I think we just have to be careful to make sure people have a right to make decisions with their providers about what they will do, and that's different than a designed experiment where somebody's trying to move a product development forward.
Most definitely. Care is different than research, and in this case, you could argue that the people involved in the study weren't given a fair shake. In other words, they were told something completely different than what was actually going to be happening, and therefore, when they consented, were they even able to consent fully to what they were actually going to go through. And when you get into that, that's where I think the unethical behavior around this whole case really pops up, because they didn't freely get to choose. There were some coercive elements with the promise of health care for the rest of the lives of the infants. The whole idea that this was going to cure, or not cure, but prevent your baby from getting HIV, which I can imagine was a coercive factor when one of the parents had HIV. And you wonder just what their understanding of the ability to transmit that to the embryos, if they did not have this gene editing, if there was even understanding of that. There's so much that you wonder about this case, and the more that you delve, the more sort of egregious things come up. So we have 5 minutes left before we move on from this topic. And we have a lot of questions up there that we didn't even get to go through, but I want to hear more from you all. What do you think of this? I know I'm worried about it because I have experience talking in the community about cell and gene therapy, and the conspiracies that always come up to me in whispered form, or the people who just outright kind of have a negative reaction when I tell them what we're trying to do with cell and gene therapy to defeat HIV. This is just going to play right into those beliefs and further strengthen conspiracy theories, further sort of the beliefs that science is unregulated and that we have mad scientists that are just doing anything for their own personal gain, and that's what this case just seems to illustrate point blank.
And this goes back to your first thing up there, our obligation as a community. We really have to focus on informing the community, informing ourselves, becoming educated on all the technology and science of this for many reasons, but one is if you don't know what you're talking about, they're not going to listen to you. Mm-hmm. So you really have to know what it's all about, and also our community needs to be, this is education is really what we really need to make sure we're doing, and we need to be doing this all sorts of ways, webinars and everything, and local forums and whatnot.
Education is really big. We've done some focus group work here in Seattle around the acceptability of cell and gene therapy for HIV cure. And the biggest thing that we found out with the people that we did in this focus group, we asked them first off if they've heard of cell and gene therapy. No. No one in the focus groups had heard of it prior to the focus group involvement. And so there's a lot of room for engaging people, for educating people, just teaching them what it is we talk about when we talk about cell and gene therapy, not alone for HIV cure, but just in general. It's a mode that you could see from our data with the FDA that it's going to be becoming more and more popular, but the audience for it, the community around it, doesn't have a basic understanding of what we're talking about when we say these things, and so therefore it takes on a Star Trek type science fiction element, and they just immediately jump to super soldiers and designer babies rather than the therapeutic uses of the technology.
Yeah, and I want to commend the Defeat HIV CAB for the work that they do every day to learn about this complex science and to help us with the focus groups. Hopefully, I think Lori will talk a little bit about those this afternoon. The paper is currently on the review, and there's our table to inform possible considerations around community engagement and education around cell and gene therapy, and also future social behavioral research around this. Because we also need to understand community attitudes.
Thank you. Any other comments before we wrap up with this? Go ahead.
So I just want to ask, do you have a project like, when we want to do something, we have a project like do you have to commit like in 10 years you will find more close to the cure? Because I see there are many different research, but the people who are more desperate to find the cure are the people who are living with HIV. So, and there is a lot of studies, I believe all are in good faith, behind consent and consent, but they're realistic how much we really are working to find a cure. Because I know a lot of providers, yes, I know a lot of agencies working for HIV, but when there is a presentation, when there is a community event, they don't come. So we can see they are not doing their work, not because they don't want to be here. Maybe they were not reaching out. Maybe we don't do our outreach that really straight to bring the people who really needs to be in those rooms. Because who we are serving, the people who are living with HIV, are the ones who really wants to hear the cure exists. Since I've been working for HIV 15 years, I hear you have a trial for finding cure, and I don't hear any advance. I don't know, just to say, my question is, when are we going to work? Somebody says, if we have an international line, when are we going to work all across the world? Not just China, United States. It's like fighting, like who wants to find a cure? No, we have to work all together because it's increasing the HIV. So people who already passed away, they go with the hope someday the cure will be here. But I think we need to work more deep in the cure than be fighting who is doing something wrong, because that's not the point. For me, the point is to get the cure. The sooner the better. Thank you.
You're welcome. Thank you for your comments there. Go ahead. 1 and 2.
Yes. Thank you so much. My question is around the work that you do in Seattle, and I'm one of those people who are following you. You're doing an amazing job, and we are really proud of you. My concern is that you are leaving the continent of Africa behind. I'm just wondering, what are your plans as defeatHIV and your organization to find ways of interacting with that left continent of Africa, especially in empowering advocates so that they can help pass this important information? And first and foremost, actually, breaking down the information of cure. Do you have plans to break down these cure messages and also to interact with advocates so that they can pass this information?
Right, so the ways that we have right now are all via social media, because that's the only way that, from my little spot on the earth, I can think of reaching way out. And it always depends on if I get reception on the other end before I can start a dialogue. So for instance, you're asking about Africa. I don't have any good examples to give you of that, but for instance, we've had some success with people in the Philippines who have also a great hunger for cure information, and through Twitter and through Facebook, I've been able to begin those dialogues where we're talking about messaging and that, but there's nothing overt. The only other way I can say that we've somewhat touched that is I've been involved with the Cure Advocacy Program through IAS and AVAC in terms of picking the selection for people who would be able to get that 3-day workshop in HIV cure in Africa. And so feeding it that way, but then I don't have really control of the content that goes on in that workshop, and so I leave it up to them, besides helping to get the people and help select that. So it's something that needs to be ongoing, and it needs to be given some sort of boost in terms of funding, because any sort of outreach and community engagement requires money behind it, and that always seems to be where we fall short, where if we don't have enough money to even do things locally, let alone nationally, it's hard to even think about the international stage, but all of them should be equally thought of by every step of the way in terms of community engagement. So wait, I had a question over here, Bill?
Yeah, I was thinking about, how many studies I've been in, and I was thinking as I was listening to this conversation about how easily I assume that the study I'm in is reputable. And in listening to the comments, I wonder if we'll ever reach a point where we start to focus on participants and educating them on how to identify, or is there a way, do you think, that we could identify whether or not a study is reputable?
Thank you, Bill. So we are over time, and we need to get our last presenter up here. So it is my pleasure to introduce to you one of Seattle's researchers. Where am I here on this? I'm going to help with this, Richard.